You mentioned HRT, something that I'm sure everybody listening has heard about. If that's the option that you go for, how long would it be before you might notice some improvement in those symptoms, particularly in terms of vaginal dryness?
I think you'd probably have to wait a couple of weeks at least for the medication to reach the cellular level and actually generate response.
And you mentioned moisturisers. We obviously use them on all other parts of our body, and we know when we don't what happens to our skin. And I imagine, our vagina is particularly sensitive, so it makes sense that it would work there. But can you just take us through some of the options in terms of moisturiser creams? It's not just using something before you have sex. This is more about actually looking after that area. Can you tell us more?
Yeah. Well, the vaginal moisturisers come in a number of options, which is a gel, a cream, and a pessary. And it's something that you would use on a regular basis for a week or so to get the tissue up to health. And then you would use it either, say, twice weekly, just as some maintenance. And what happens is that your vaginal tissue, the lining of the vagina, is actually in a healthy state to go forward. And the advantage of perhaps of a cream is that they're actually lipid-based, so they're absorbed into the cells of the vaginal wall quite well and actually plump up and rehydrate that vaginal wall.
I know Dr. Wolff's Vagisan moisturising cream is a really excellent option. Can you tell us why that is?
Well, it works. It's pleasant to use, and it becomes a really nice option in that repertoire. It's effective.
Are we able to access those moisturising creams? Like, do we need a prescription? Do we just go to the chemist? How do people get them?
So, HRT, you do need a prescription. All the other options you can get over the counter. So they're all readily available, and that's why I stress so much that if you've got symptoms, get them checked out first by a doctor to make sure that your discomfort is not caused by something else. Because we often, as women, we're not educated to know that our labia can actually have skin conditions, that can cause discomfort. And we don't look at our labia very often, so we wouldn't know it's there. We just feel discomfort. But a lubricant or a moisturiser would not be the appropriate treatment. So if you've got pain there, get it checked out, and then you have some choices of how you manage it.
And would it be a situation where you may take HRT and also use, a moisturising cream or pessary or something else? Absolutely
Not a problem. We all suffer degrees. And if you are uncomfortable, then using one of these products, like a lubricant or a moisturiser, to increase your comfort is absolutely the right thing to do. Pain and sex in my world don't come together.
Okay, well, that's great to know. And I guess it can be trial and error as what works for you as well.
Yeah, we're all individual, and that's why it's so lovely to have so many options. Because it allows you to tailor it to yourself to find what works for you in a nice way. The advantage over a moisturiser over, say, a lubricant is that a lubricant you use at the time that you're making love, whereas a moisturiser is something that you use removed from the love-making situation, so there's not that extra, perhaps potentially intrusive element that's coming into your love-making.